Hi, my name is Nathan Benefield. I'm from Camp Hill, Pennsylvania. I want to share some of my thoughts on healthcare reform with you. Unfortunately, too many folks in Washington, D.C., in the state capitals, and in the media think that there are only two choices. You either support healthcare reform, or you don't. And that's just not the case. I support healthcare reform, but I can't support the policies that are being rammed through Congress right now. I don't support an individual mandate to buy insurance, and I can't imagine why some people who demonize big insurance companies for their price gouging or for making too much profit think the solution is to mandate that everyone in America buy their products. I oppose giving $1.5 trillion, or $1 trillion, or even $800 billion in subsidies to insurance companies over the next 10 years in order to underwrite premiums for families making $88,000 a year. If you think that health insurance is costly now, wait until we subsidize it. I oppose federal mandates on what every insurance policy must cover. I can't support new taxes on the uninsured, on employers that can't afford to offer coverage to their employees, on the so-called rich, on healthcare benefits or on insurance premiums, on smokers, on soda, or on whatever silly scheme is thought up next. I can, however, support reforms that help lower the cost of healthcare. I support real competition, not a new government agency, but allowing consumers the right to shop for insurance across state lines. I checked up on ehealthinsurance.com and found that I could save 25% on insurance if my zip code was in Ohio instead of in Pennsylvania. I would love to take advantage of those savings, if only my government wasn't preventing it. I support changing the tax code so that individuals truly own their own coverage. I have my health insurance bill right here. I think it's silly that if my employer pays this bill, it's tax-free. But if I pay it out of my salary, taxes will be taken out first. This is a really poor policy, and it's led to a system where if I lose my job, I'll lose my coverage. I also support reducing the number of government mandates on coverage. Pennsylvania currently has 52 mandates which drive up the cost of insurance. And these are basically handouts to every special interest group in the medical field. I know many people think that these mandates are needed to protect consumers. But I'm a smart guy. Don't let my good looks fool you. I think I know enough to decide which types of coverage I'd like to opt out of. For instance, as a single male in my 30s, I don't see why I need to pay for coverage for mammograms. Unfortunately, my government requires me to pay for that, driving up the cost of my coverage. And for many people like me, this drives them to skip health insurance entirely. For a long time, we've been moving the wrong direction on healthcare policy. I want reform, but the kind that gives me, not the government, more control of my healthcare. Thanks for listening. I was Nate Benefield.